Hi, one of my names is Dr. Elaine Cagulada. I'm the research officer for the Canadian contingent of Disability Matters, a major 6-year pan-national research program funded by a Wellcome Trust Award that's transforming health research and environments by countering simple stories of disability with more complex and care-filled understandings of disabled life and living. My experience of self and world is textually inscribed by and socioculturally represented through narratives of disability, race, deafness, queerness, in simultaneous, entangled, and distinct ways. And thus, I'm incredibly grateful to be working on the phase of the Disability Matters program, that is, Phase 5, concerned with reimagining and representation. Together with Professor Tanya Tuchkosky within OISE's, that is, the Ontario Institute for Studies in Education, Department of Social Justice Education at the University of Toronto, we enliven, inhabit, and mobilize the asking of the question, in what ways can we reimagine representations of disability in health research? Thus far, we've been particularly animated by the reimagining representations of disability aspect of this question. Indeed, for us to undergo the important and urgent work of reimagining required of Phase 5, we feel we must first gain a better sense of how representations of disability are presently imagined. In May 2025, we hosted and organized a Spring Institute titled Disability Matters, Infinity Sign, Ways of Perceiving, wherein we had conversations among international community about perceptions of disability within and outside the domain of medicine. At around the same time last year, Tanya and I conducted interviews with physicians about their perceptions of how disability is represented in medicine. We spoke with physicians specializing in pain, mobility, and general medicine. Notably, one physician noted wishing that medical students in training, including themselves many years ago, might have been exposed to other representations of disability, beyond, of course, the overexhausted representation of disability as a problem to be fixed, tested, rehabilitated, or solved. Enter then Professor Tichkosky's development of a graduate course offered within the Department of Social Justice Education titled Disability Matters. The development and successful formation of this graduate course followed a consultation with disabled MAD activists, researchers, scholars, and teachers working and in some way related to systems of medical care. Together with Tanya, we curated and facilitated this consultation in hopes of exploring disability matters as they relate to current research and the development of curricula, both critical and relevant to how disability is imagined and therefore treated as a problem. To date, we let ourselves be led by the question of how indeed disability is dominantly narrated today as an objectifiable problem and therefore represented as such in our ways of speaking about disability, especially in medical and health domains. New terms, definitions, models, treatments, and old ways of narrating them into reality abound. Making use of an interpretive studies-informed version of disability studies, our way together in Phase 5 explores the cultural milieu reflected in medicalized understandings of disability in order to begin to try making different with the old. That is, analyzing how disability is represented in our normative social order, so that we might begin to reimagine the possibilities we make of embodied differences together. Our approach is part of broader projects poised to develop pro disability approaches to scholarship, reshaping the priorities of health research and promoting inclusivity. Overall, our interpretive approach has made possible exploring the complex and nuanced ways that disability is given meaning then and now. Or perhaps otherwise put, by living in curiosity and wonder, we've begun to experience the reimagining of representations of disability in health research. Thank you.